call the special meeting to order. Would you all please rise and join with me in reciting the pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Mr. Clerk, when you're ready, would you please call the roll?
Chittick.
Here.
Luddington.
Here.
Patrick.
Here.
Bruner.
Here.
Lorenzen.
Here.
Farnham. Voigt.
Here. Okay, we do have a quorum. I'd like to open the meeting up for public comment, reminding folks that we ask that you confine your comments to within a 5-minute deal. I guess I'm kind of just talking to hear myself talk right now, but is there any public comment? Hearing none, we'll move on to the business. Well, let me just say, first of all, we have, as a county, run 62 tests. 60 of them are negative, 2 are pending, and there's 0 positive at this point. So the tests are running through rather quickly right now. I want to let you know we did have a call last night, a conference call with some of the other area county board chairmen and legislators and governor's assistants down on the totem pole. Nothing was really resolved, just to get the message across that we would like to be considered. The legislators wanted to know whether we wanted to be considered as separate from larger metropolitan areas, and we said yes, but the key word is caution, and how we approach it should be obviously phased. We need a plan, and based on what the governor says this week, we may get that guidance. Okay? So, yes, please.
Do you know what criteria they're using when they test? You know, only test 60 people and we have 17,000.
That's a swab.
Yeah, but is the reason why we're only testing 60 because they show signs, or because we don't have enough tests to test other people?
Well, that's actually a health department question, but my understanding is it's either a doctor order or when they go to the emergency room, there's enough signs showing that they believe they need
In
tests.
other words, if I want to be tested, I can't just go say I want the test.
Well, you might be able to, Ian.
At my age, I probably could. Yeah.
You probably could.
You might
I'm
know
not being
somebody in
funny.
the lab too.
Pardon?
You might know somebody in the lab too.
I know a lot of people in the lab.
Thought you
They're
might.
not real proud of
I
it.
get kicked out all the time.
You know that, don't you?
Maybe you
I did talk to Jill.
It's just kind of unusual that we don't have any positive, but we know we have some positives out of 17,000 people.
You would think so.
You assume that we don't know that.
I know we don't know it, but I understand.
You
that.
would assume that we probably would. But
That's a safe assumption.
Right.
I think everything we should do
I mean,
is
it's nice the way it is, I agree. Go ahead.
assume the worst and plan for that, and then,
Assume the
Right.
best plan for the worst.
right.
Right.
And that way we're on a position that, we feel is justified.
Yeah, there's 11 counties that have no positive yet?
There we're down to 9.
9, okay.
That's as of yesterday.
Well,
They don't know.
Done pretty well,
Yes, they have.
considering everybody else.
That's-
There's 102 counties and there was 93 counties with at least 1 case yesterday.
So it's still not bad, I mean, considering.
No, and some of the areas like Douglas County,
Mhm.
I was talking to him last night, all of their cases came from Carl,
Yeah.
and they're all recovered. So, I mean, you can also look at it by zip code if you go into some of the computers in some of the sites, you ask for like Edgar County or whatever, it also breaks it down into zip codes, so you can look that way. And there's not much around here.
No.
But that doesn't mean that can change on a dime.
Hey, you can't think, one more comment. You got, Vigo County has over 100, 200 positive, and those people come here and shop. You'd think we would have more cases.
We can't
Kind of
explain it.
Pardon?
There's no explanation for
No,
it right
I
now.
agree.
I did talk to Jill and Janet again this morning, as also last night, or before my phone meeting. And Jill was going to investigate and talk to the hospital, find out what the state has to say about increasing or improving this type of testing that we are doing. The big issue we have is that we are a small county
Right.
with, and then on top of that, you layer in that we have no cases.
Mhm.
So we're probably, as far as the food chain, is as far down as you can get. But it was still worth investigating how much, what kind of tests are available, and coordinate that with the hospital, because we have no resources to coordinate that unless we work together as a
We
community.
may not be getting the better tests either. We may be getting one that takes 4 days or 5 days.
No, we don't even have, that's not even taking place. We're getting back tests, the swab test that normally was taking 4 days,
Okay.
we're getting it back in less than 24 hours.
Okay.
Okay, so, I mean, that part is good, okay? So we have improved that way. So, I was gonna apologize for getting off the track, but that's pretty much the track lately, guys, so. Any rate,
Well,
the only actionable item that we have this morning is the resolution on the sales tax referendum. We need to initiate or pass a resolution that states what happened in the election so that we can start collecting the tax. Now, I hasten to say right away, we have to have that to the Department of Revenue by May 1st, or April 30th,
May 1st.
one of the two, in order to start collecting it this year. Now, it is not going to be collected until, or start to be collected till July 1st. So it's not like we pass this and then tomorrow it's gonna be collected, okay? Any questions about that?
Are you going to read the exact resolution?
We can.
Yeah, and for the record, I did email it out and I mailed it out, but we do have it.
I didn't get it in the mail, sorry.
Okay, we certainly do have it. Do you have a copy, or do you want me?
I don't have a copy. I can read it or you can read it.
And I'd be more happy to go make more copies if you'd like, but
Yeah, I got it.
I guess I should have checked my email. You can paper airplane it to me if you're worried.
no, down. One of those says John.
Yeah.
I don't know that it's in there, but it might be.
She live in the sticks.
Tell me when you're ready, Mr. Chairman.
Nope, I'm not seeing it.
All
Well,
right.
go ahead. Yes, sir.
Whereas pursuant to the statutes, a county board of any county may impose an income tax upon persons engaged in the business of selling tangible personal property at retail in the county on gross receipts for sales made in the county of their business for public safety tax purposes. Whereas at their December 11th, 2019 regular meeting, the Edgar County Board passed a resolution which authorizes the county clerk to place a referendum on the ballot of the March 17, 2020 general primary for a 1% sales tax to be implemented if passed by its electors to pay for public safety purposes. And whereas the Edgar County clerk has certified the results of the March 17, 2020 general primary to the Illinois State Board of Elections and has declared that the referendum passed with a majority voting in favor of said sales tax. Therefore, the Edgar County Board hereby declares that a public safety sales tax of 1% be imposed upon all persons engaged in the business of selling tangible personal property at retail in the county on gross receipts from sales made in the course of their business for public purposes beginning July 1st, 2020, and therefore the Edgar County Board directs the Edgar County Clerk to file a certified copy of the resolution and a certification of the results of the election authorizing the imposition of the sales tax to the Illinois Department of Revenue on or before May 1st, 2020, in order that the aforementioned public safety sales tax will take effect July 1st, 2020, and be it resolved that the tax is hereby imposed and all civil penalties that may be assessed as an incident thereto shall be collected and entered by the Department of Revenue of the state of Illinois, and be it further resolved that all resolutions for parts thereof in conflict with the provisions of the resolution are, and in the event of the conflict expressly repealed on the effective date of the resolution, and be it resolved that the Department of Revenue shall have full power to administer and enforce the provisions of this resolution. It's wordy, but that's the way it was presented.
And that will include in that, they will they will follow the law as to the exemptions, et cetera.
Sure.
Motion to approve the resolution. Andy
Can I
moves.
make a comment?
Dan second, or I need a second before we discuss now. Second by Derek. Okay.
I don't know if I should do this, but I called you yesterday morning, and I made a comment, I didn't know if this should be the proper time to put a tax on people because of the way the economy is and the way people don't have jobs. But Jeff explained it, we have to do it by May the 1st, which I didn't realize, but still, I don't know if this is the time and place to add a tax to the people of Edgar County. I don't know if anyone else feels the same way or not, but that's how I feel.
We won't, believe me, I'm not
Yeah.
hip on paying more money. It won't come due till July 1st. Will be the first.
Yeah.
That's a
The
penny
flip
on
side of
that.
that, Dan, is we're in a place where we're relying on our first responders, where, you
Yeah, I
know,
realize
safety is
that.
front of mind for everyone. So in order for the county to ensure the safety of our people, we need this money to make that happen.
I realize that too.
The other thing I remind you in the phone call, you just wanted to delay it for 1 day, or for 1 month.
Right,
And it's actually gonna be delayed for 2 months.
yeah.
Okay? Morning, Carl.
Still, something's right.
The other side too is what people are spending their money on. The things that are taxed are gonna be limited
Yeah, the food,
by the very nature of how this tax works, right?
not new cars or
Right.
new houses or,
Good thing.
Groceries,
right,
toilet
Drugs.
paper,
toilet paper.
all the vitals, yeah.
I know. It's just still bothering
Well, do we have an alternative?
us. No,
Well,
no, we don't.
Any further? Carl, we're in the middle of we have a motion to approve and a second to move the resolution on the sales tax. Do you have any kind? I know you missed the discussion, but, okay, I assume you're ready to vote with the clerk call the roll.
Chittick,
No.
Luddington.
yes.
Patrick,
Yes.
Bruner,
No,
Lorenzen,
Yes.
Farnham,
Yes.
Voight,
Yes. All right, gentlemen, is there anything else to come before the meeting this morning? Hearing nothing, I'll entertain a motion to adjourn.
So moved.
Second.
is this a
Second.
special meeting we're adjourning?
Yes, that would be Derek and Phil.
okay.
All those in favor signify by saying aye.
Aye.
Opposed, nay. We'll take a break till 9:30, which is just a few minutes away. 1 minute. Huh?
So are we officially adjourned?
Yes, we're officially,
make
we are
it
adjourned. Okay, we're gonna go ahead and start the study session now. I'd like to invite anybody that has any public comments to make them. Hearing none, I would like to ask Sam, in case you have other things you need to get to, if you have a report. I did give them Esda's report that we've tested 62, we've got 60 negatives and 2 pending. So take her away, Sam.
I don't really have anything. I mean, we're in fairly good shape. We don't have, we have really good supplies of PPE thanks to ESDA and them getting their orders in from the state. Our volumes have been lower, but we've been able to flex staff and do some different, doesn't affect emergency and EMS per se, but just the hospital in general. We have weekly calls with the regional hospitals to make sure that we're not seeing anything or doing anything different than any other place is doing, and seems like we're all kind of in the same boat right now. So I truly believe the curve is flattened, and I think that we need to slowly open things back up for economic purposes, just my own opinion, but we're working towards that. We have meetings this week to offer some different services at the hospital, some drive-through testing. When I say testing, I don't mean COVID testing. I mean, if you wanted to come and get your blood drawn, but you were fearful of coming into the hospital, we're offering some different services to be able to accommodate our patients, to make them feel safer coming on our campus.
So if you have labs, like doctor orders labs, and I can have my blood drawn outside, you don't have to go into the hospital?
Correct. We put the infrastructure in place last week as far as the IT piece of it. It's not just having a human come out and do that. We have to, we have to register, we have to collect insurance information. You don't have coffee machines in the parking lot. There's an infrastructure that has to take place in order to make that happen. And so we've tested that last week. You'll see media this week surrounding that as well. Still increasing our telemedicine services, so anybody with smartphones and smartphone capabilities can have a virtual visit with their physician or their provider for just their regularly scheduled visits. We're seeing all well patients from 8 a.m. to 2:30 p.m. and then scheduling all sick patients from 2:30 p.m. till 5 p.m. because we have a greater volume of well patients than we do sick patients right now, and still having our respiratory clinic up and going and segregated away.
I know that ESDA got in, I think, 10,000 masks and several thousand gloves, along with other items, hand sanitizer. There was a bunch of things that came in. What has there been any talk of? I know we're still using the swab testing for the COVID-19. Is there any talk at the hospital of getting any other types of tests? Either
We've had the Abbott IgG test on order since early February, but
which one is that?
that's
That's
the
the
antibody test to see if you're a carrier.
Okay.
If you've already had it at some point in time and you have immunity. We downstate will never see those tests.
Okay.
They will all be locked up in the Chicago district. And frankly, a county that's still white on the map, they wouldn't send us one anyway.
Yeah, we're down to 9 counties now.
Yeah.
Well, as of yesterday. I
When you
don't know
say
where.
that IgG test, is it like the system that we use, or actually the individual, or how does that actually work?
It's an analyzer, and then it has cartridges that kind of like a blood sugar, like you prick the finger and you put it on a cartridge and then you slide it into a machine and it does a test and spits out a result. It's an Abbott Labs test.
But you do have it on order. I'm sorry, Dan, go ahead,
Ask
please.
it.
I noticed the regional hospital has changed their trauma. They're no longer a 3, so if you have someone who wants to go to regional and they have a heart attack or something, they won't take them, is that correct?
No, that isn't correct. So, yes, they
You might
have,
explain the difference between trauma 2 and trauma 3. They went back to trauma 2, correct?
they went down to a trauma 3.
Okay,
So, but that'll be effective August 1st.
okay.
So they're, at this point, what they had to advertise is that they don't have the staff capability, surgeons, specialists to be on call in the hospital 24/7 in order to meet that level 2 criteria. So they are bumping themselves back down August 1st to a level 3 criteria, which means they still have the capability to handle some things, but the physicians are not housed inside the hospital, are not arriving within 30 minutes to do surgery, that type of thing. So that limits us from being able to take patients to the Indiana side from the scene of an accident. We're still at that point. Carl has always been a level 1 trauma center, and so we would continue to take patients to Carl. We had the option of taking certain things to regional. Regional's never really had neuro trauma, so if it was spine or head injury, we typically didn't take there anyway. But now, multiple bone fractures, ATV accidents, things that we would ground to regional, starting in August, we won't have that capability unless they hire more doctors between now and August 1st and they have that capability.
Thank you, Sam. Any other questions, Carl?
Yeah, I haven't talked to any of the fire people, but I assume all those and other ambulance services are getting all the equipment they need as far as you know.
As far as I know, I do know that there's been at least one volunteer fire department say that they weren't gonna respond. They had PPE, but they just had, I believe, maybe an older population of responders and they felt a little bit more vulnerable. But the district received PPE through ESDA and it was disseminated through the fire district. And then the same with Paris Fire Department, they've received PPE through ESDA as well as cleaning supplies. Chrisman, they've gotten some things from ESDA, they've gotten some stuff from us.
Sounds like everybody's not lacking this equipment.
And Jill was making the rounds today, disseminating more stuff that we'd gotten in. I think she got it in like 4 o'clock on Friday afternoon, so they were out disseminating.
If people contact us, we steer them to ESDA because she has a inventory at the fire training center that she keeps count of.
What's your criteria for testing patients? Do you test all of them that come through ER or VARS, or just ones that show signs?
No, you don't automatically get a test. That is not how that works. The state IDPH sets the criteria on who can be tested through the IDPH lab. So right now, the criteria is anybody exhibiting symptoms, fever, cough, shortness of breath. They live in a congregate living setting, so like long-term care or your Tanner Place, Highview, those types of things. Healthcare workers, gas station attendants, food supply chain attendants, those types of things. If they are, and they have to have had a negative flu swab and a negative strep screen, you have to rule out other things before you're allowed to test for COVID. Now, if IDPH declines to test, we can still send it to private, to LabCorp. So we still gather the test on most patients that are exhibiting symptoms. If IDPH declines it, then we can switch and push it over to
Which
LabCorp.
one's faster, probably the reference lab or the private lab?
No.
Faster? Oh, is it?
No.
Okay.
IDPH is about a 2-day turnaround. LabCorp's usually been 7 to 10 because they're so backed up.
Okay.
So you've got the stuff to do the testing, it's just a matter of sending it off and
Yeah.
look at their emergency, basically.
Thank you, Sam. Appreciate it.
You're welcome. Thank you, guys.
Okay, thank you.
Okay, we'll start down the list. Andy, do you have anything this morning?
That bill you sent me, Augie, on Smart Lock, you remember? You said it looks like the same dollar amounts, it's the same bill.
It's the same bill, but the dollar amounts aren't the same.
I didn't think so, they copied both of them, that they're the same.
Because it was invoice number 4 that they sent me, and that's what caught my eye. And I didn't bring it with me, Andy, I'm sorry, I didn't
I
really
did.
talk about it. But
Maybe they didn't have the first bill, then we didn't pay before they generated
That's what I
additional
wanted,
cost.
my question was.
No.
Look back,
I think what it is,
I copied
is the same general language. Building, envelope, HVAC. I think it's just a continuation of that,
That's all I
but
do.
at least what I got of the two exact same things, so maybe.
are the dollar amounts the same?
The dollar amounts are the same,
Okay,
and they're
well-
they're the same invoice number.
It didn't look, okay, well, they sent it to me as number 4, and we've only paid 3.
Okay.
So We'll look into it.
Okay.
Well,
We need to also make sure that we've gotten the money to pay the bill.
And we do.
Right.
So as far as completion, they're doing as much as they can do. I mean, if you notice, both air conditioners are gone in here now. They got the fence up, they're waiting till things break so they can basically wrap it up. 'Cause they're
And they postponed the jail lighting in the old part until the 20th.
the 20th.
Right.
Well,
Which is today.
I think what they wanna do, they've got lighting to do at they got like 2 days worth of lighting to come down. And so they'd like to send the guys down and finish up the health department. And then, I think they got a couple things here that they need to finish and then go down there and finish that. So they'd like to they come from over by St. Louis.
So they want to do it all.
Do it all in a couple days and be done. So, we may have to probe them a little and have them come down and finish that jail. We'll see. Other than that, everything's pretty much done. What's that?
Is it ready to open, do you think?
The jail?
Yeah.
Not
That's
quite.
another subject. Yeah.
But once they get the lighting in, we'll be fairly close.
What about all the jailers and all that? We're still
Well,
not
that's
hiring
different.
yet,
That's,
correct?
doesn't have to do with smart wall, but, they're, I don't know, you wanna say anything on that? I mean, they're.
Well, when we get to
they're-
that,
Okay,
when we get to,
but,
I assume that the HVAC stuff at the health department isn't complete yet, or
it's
is it?
not complete. Cause
So
they
that's probably the last thing that gets done.
probably not be the last
Overall.
thing. They'll get the light, if they'll let them come in, the lighting guys will come in and finish theirs within a couple of days. But there's still a decent amount of HVAC work to do down at the health department.
Is that it? Is there anything else, big things hanging out besides that?
Don't, no, I think they've got the infiltration, that was the first thing they did. Lighting they got, really, the HVAC is the big finish up, and then they'd be done down there. So, like everything else, just kinda on hold.
Did they get the door it is so it closes?
I don't know, I've been using the back door.
It's been 3 years since they asked to have it.
Oh, it's been
I bet you
longer than
guys thought
that.
They were gonna go fix it, and then.
Well, last time I was
You had
down there,
somebody
I
said they
talked
were
to
gonna
her.
fix it. You had somebody said they were gonna fix it too, didn't you?
Yeah.
Well, but,
Welcome to my world.
and I was talking to Jill down at Estes before Smart Walk went down there. I'm like, well, they're putting door sweeps and sealing the envelope, and if the damn door doesn't close, that seems like it ought to be part of that project.
That's part of the envelope.
That, I've looked at it, it's gonna be a process to fix that, cause what's happened, that's a metal door, metal jamb, metal door, and it's settled in some manner. It's gonna be a lot to work to get that to work.
What are they doing?
How much a door like that costs?
I don't know.
Somebody's got a grinder, right? I mean,
Yeah, plenty of
come on.
money.
It doesn't work like that.
Yeah, plenty of money.
Okay.
If they're putting sweeps, I can cut the bottom inch off.
Yeah, but then you have nothing to slide that sweep into if you cut the bottom off. It's just, anyway, I'm sure that's probably why it's not fixed. Somebody went and looked at it and goes, man, this is
Just
gonna
going
be.
back goes in.
You got to pretty much take it out, probably spring it back, fix the door jamb and then put it back in, but anyway.
Have you been out to the new area where the detectives are gonna be at all yet? Anybody? It's pretty sure. That's gonna be a nice facility.
What are you talking about?
Okay.
Out.
Go ahead.
Housing. Yeah,
Out there at the Housing Authority, what used to be their rec center, there on the corner as you go in on the east side, right there on the corner, is a building, and it's got an interview room, a couple interview rooms, a couple of offices, a training facility, training room, a conference room. It's got a little kitchen. It's pretty nice. That's available to us for $1 a year from the Housing Authority. So we're looking at using that for the deputies and investigations and so forth in there. And pulling out of the jail for the time being and putting those functions in there. When I was there, Ross was there. He was out there looking at communications and cameras and things that needed to be put in. and hearing from Derek Weston on when he wanted stuff and where he wanted it, et cetera.
Well, is
So-
the city police department still, they used to have, I guess you call it a satellite office or whatever out there. Are they still using it? I
They don't
assume
use
No.
it anymore. No.
So they pulled out and we're moving into these spaces.
Actually sound like the housing, like Scott was kinda glad to have something in there.
Yeah.
Somebody use it.
Yeah.
So at any rate, I just wanted to mention that. I did mention to Derek to make sure he got with our insurance agency to make sure we did whatever was necessary to cover ourselves as far as insurance for that structure and what's necessary. I don't know whether the housing authority, sure they have it insured, but we as an occupant may want to have something
Insure
done.
contents.
Right.
Yeah.
So, okay. We might as well talk about the jail. We had a get together, well, we talked about it in a study session, last time in a closed session, or was it a regular meeting? I can't remember when we talked about stuff. I'm losing track of days.
I know.
At any rate, to answer your question, Dan, we're not near ready to open yet, and even if we were, we can't get the DOC, Department of Corrections, or the insurance company has nobody available because of the COVID-19 virus available to even approve and run their inspections. We've still got some physical stuff to do. I think a lot of things, one of the things that Derek and Austin and I talked about after the meeting last time, that's what it was. The three of us got together and they want stuff that's already developed, like our training manual, the operations manual, all of that stuff. They were working to communicate to the insurance company so that they had that available. Austin had talked to Jeff Wheeler, that's wrong. Jeff, what?
Green?
No,
Yeah.
Weber.
Weber.
At any rate, and talk about they want to test our ability, one or two of our people take us through, have them take them through an actual, yeah, the process of getting a prisoner in there and so forth. As far as having it staffed,
That's what,
we do not have to have it totally staffed to get approved, because that would make it difficult. What happens if we didn't pass the test? Then we'd have these people hired. They understand, there's no problem with us. Hell, right now we have 4 jailers that are trained. We need more than that, but we don't have to do any more than that for the insurance company right now, okay? Does that answer that question? Okay, I just want to make sure.
people ask once in a while.
Right.
Not as many because we don't have the coffee club in the morning anymore, so.
Derek Weston, talked to him about expanding the patrol and/or investigation, and we're gonna hold off on that till after the first of the year, or after the fiscal year is ended. That will be a 1-year deal, if you know what so, that was Derek's idea. He heard everything and he goes, let's just continue the way we are.
That's a good decision.
Okay, and so I wanted to make sure that everybody was aware of that. I'm sorry, I got carried away here. What else? What other questions on the jail? I mean, we're close. There's still some stuff that they have to do as far as, what are they called, knockouts? You know,
Chow doors, what they call chuck holes.
chuck holes, thank you. Again, time and my mind have all left me. But at any rate,
Slide food through the door.
Oh, okay.
it's pretty amazing. Even the older part, it's
Quite a transformation.
friggin' amazing, okay? So
Once we get all this done, how many prisoners can we hold?
30 or 32, Carl? Does that sound right?
That's the old part in the new part.
Yes,
Maybe not quite.
30-ish,
I think it's either 28 or 30.
Yeah.
Depending on how many they use in them isolation.
and whether they use the isolation shells and stuff, so.
And personalities, gender, everything else.
All right, so everything's moving along. I feel really confident, having talked to Derek, that things are moving. Derek Weston. Okay, so at any rate, you have a few things I think to tell us from the dog. We had a dog bite.
Andrew, called Friday afternoon, she just got out of the emergency room, she got attacked by a dog at the kennel.
And it wasn't a pit bull.
No, it was a German
German
Shepherd. She had 10 stitches in her arm. So she was on pain medicine, so she was kind of loopy, but haven't talked to her today. But she seemed to be doing all right. So.
No, I'm not on pain medicine.
Yeah.
I'm just goofy normal.
I'm assuming that's a workman's comp claim.
Yeah.
That would be it. And I also asked her about call outs. They don't have one call out, so that's going to cost us $25. Remember what was going to pay him. So. And the dog was dead when she got there, so it was run over by a car. So. Other than that, everything out there is great. I'll call her today and check on it. But I think she's still working. So.
Thank you.
You're welcome.
Derek, airport, 23rd.
Is that the date of the,
Bids.
yeah, so we're waiting to see what that looks like. The other thing that came out via email is the FAA portion of the CARES Act and what that looks like. It sounds like is that there's going to be 100% federal coverage of things earmarked for the 2020 year, right? So unfortunately, just by the nature of how things have run around with us, we don't have anything in the pipeline right now. So Hanson's working on it. They're going to get back to us if there's some sort of change or some way in, but that's, if you hear something about that, that's how that pertains to us. Right now, we had one confirmed bid, one pending, it sounded like, or.
And he was gonna call
Or,
him.
yeah, so we should know here in a couple of days whether or not our project as it exists in iteration 3 or 4, whatever it is gonna go forward for this year, so that's all I got.
Phil?
One question. Chris Patrick still have a hanger out there? Just wondering. I know you have some problems there. So.
Sure did, we covered it. Talked about
Pardon?
it. So we talked about it in here.
I know, that's fine.
Okay.
If he's still there.
You said you had a kind of like a little standing room, or a list of guys that wanted it, if you ever had anything.
There were 2 in the hopper,
That's
so
what
we need to figure out, the one issue there is when his actual lease is up.
I have a question.
Fire away.
Keep hearing there's 2 people on the waiting list for a hangar. Is that kind of the norm? And, you know, it seems to me if we have a waiting list for hangar space, we either need to figure out how to get more hangars or figure out our price point and up the prices a bit to get our demand and supply across at the right place.
Yeah, well, I would say 2 in the hopper is probably just about the sweet spot. You know, if we had, you know, I don't know what the smallest T-hanger expansion we could have, and that's a whole different piece of the state and federal bidding process.
Sure.
It works differently. But I would imagine, you know, any plans we've had, I think it's like 6 is what's the expansion there. So I still think we're a ways away from that. It's hard to, I'd say if anything, the trend line for personal aviation is probably going the wrong direction for expansion, but
Especially right at the moment, yeah.
it's a good way to get away from people. I mean, you know, get up in the air, but.
Okay. Thank you, Derek. Carl? John? Okay, the new bill that was agreed to last night by the Senate and the House, but not passed yet. The Senate's supposed to pass it today. I think it's 450 billion, plus or minus, just so you're aware. It's going to provide 150 billion for states and local fiscal relief for lost revenues and budget needs. Of that 150 billion, For counties only, there's 29.5 billion for counties. There's another 29.5 billion for cities, towns, and townships and villages. So what we're interested, obviously we're interested in all of this. Illinois' share for counties, not for the state, just for counties, is $1 billion in Illinois. So I just wanted to make you aware of that. If it all passes, there may be some relief for local counties here, including ours.
In what form? Like lost, lost sales tax, lost?
Well, we don't know
That part
yet.
we
Some
don't
of
know.
that, plus some of the stuff that we've spent on COVID, payroll, et cetera. My understanding from Augie, and I haven't read the the thing, if you toggle down to Edgar, it shows $1 million would be available to us here. I don't know whether, isn't that correct, Augie?
That's the way I understood it.
Yeah.
Yep.
So,
$1 million available to who?
Edgar
Just
County,
Edgar County?
yes. We have to reach the criteria to
Right.
get that money.
Right,
And we haven't seen that criteria yet, Carl.
okay.
But this is what we understand, and I'm reading it right off of NACO's website here, so.
And now, how I read that would basically be, we have to prove lost revenue. You know, say if our sales tax revenue was normally at $1 million and, you know, for this period it's 500,000. Property taxes would be a good thing. I mean, that's gonna be interesting to see how many people can't pay their property taxes, but that's the big
When
chunk.
when
of
it's
it.
coming out, it can come out on time,
What's that?
property tax bills coming out on time.
We
We
have
haven't changed it yet, but
Okay, I just want
my understanding is that we will still
citizens.
be under the same, I'm sorry, Dan, did I interrupt you?
No, I just talking to myself.
Okay. My understanding is that we would be operating under the same time frame as we were last year, at least at this point.
Isn't it, when does the first installment, is it May sometime? End
No,
of
no,
May?
July.
July.
July's
July
the
and
first?
September.
July, yeah.
Mid-July, it's, well, no, it'd be, yeah, roughly, yeah,
July, okay.
yeah.
Well, I'll ask you, Augie, I know you're involved in that to some degree, aren't you?
Yes.
With your limited staff and Don's limited staff, is that even possible this year?
We're working to that end. And yes, I do have a new employee that will be working on that. I'm right now in the midst of setting up a training schedule, and the cost for that. So, but we anticipate working just like we have every year to try to get it. Our portion, takes a while, it's data entry, and then we hand it off to Don to print the tax bills. We try to get that to him by the end of May, early June. I'm still working towards that end. So at this point, I see no reason why we won't get there.
And from our standpoint as a board, because I assume we would have to move the date back. It's something to keep in mind in the next couple months, but I don't see any reason to get to it right now because nobody's going to be mad if we bump back the property tax date the day before the due.
Actually, that's a function of Don, not
Let's
us.
say we
Oh,
don't make
is
that
it?
decision.
Okay.
Yeah, Don will do it, you know, most years we're later than we're statutorily supposed to be,
Right.
okay? But Don usually handles that as a
Okay.
function of his office. Doesn't mean that we can't offer advice, and we're already starting to coordinate with Augie and Don on those issues. Augie and I have talked about it, and Don and I have talked about it, so.
Well, Augie sent us three, like Kane County and Sangamon County and something that they had passed resolutions, when that resolutions that extended, one of them actually waived any
Penalties.
penalties, the other actually moved the first date to the second date, and then,
Yes,
And then-
pushed it back.
so there's different ways that, but that is required by resolution to do that, correct? Or they just did that?
Well, statutorily, as the chairman said, we usually are a little bit behind, but let me tell you that that doesn't make it right that everybody else is behind, but the majority of counties, it appears that they are.
Okay.
And it's just never been an issue, it's just what works, it works for us. I know there's a county up north that has all of their, all the assessments are in, they're basically done with their taxes, the inputting, which is the county clerk's function, and they're just waiting now for the treasurer to send out the bills. So they're getting ready to finish the process where a lot of counties, including us, we haven't even started. I mean, the assessment part we have,
Okay.
that always.
We've
that's
got our
done.
multiplier, all that stuff is done.
Yeah, so it's, and I don't,
They have more
like I
help.
said, just because everybody else isn't meeting the statutes, that doesn't make it right, but it's just the way that it is in the state of Illinois.
Okay.
But I can assure you that from my office, we will work on it as soon and as hard as we can to get it over to the treasurer. And yes, as he said, the treasurer will decide when he puts those dates out there. Does that help?
Evidently, the state is allowing some of these counties to change that a little bit.
Evidently,
Yeah.
yeah.
And they may be doing it just as a,
For the record.
yeah, for the record,
Okay.
even though it doesn't have really any force. Okay? Because we can't change state law
Right.
by a resolution or declaration or even an ordinance, okay? So, but I'm sure as John said, as the weeks passed, we can evaluate things as things come along. I wanted to also inform you, I think that some of the salaries and or hourly wages that we pay that are listed, thanks to Don's accounting practices, we can list and quantify very easily as far as what we've expended on COVID-19. So that may be, may not be available to us, we don't know, okay? But that's certainly gonna be easy to count for because of what the treasurer and the treasurer's office has done and what our administrators, how they filled out their forms and so forth based on what the treasurer's office has done, okay? We just have to see. I just wanted to make you aware.
I've got another question. As far as the shutdown of the courthouse, I know, I guess that was as a result of the governor.
Yes.
And, you know, over the weekend, or last week, I guess, the president, these 3 phases and everything, so maybe that might be something coming in the next month or so, you know, change on the governors to get this courthouse open back up.
Prior to you getting here, I let the board know that about 4:30, 5 o'clock yesterday, I got a call for a conference call at 7:30 last night where area senators and governor, low official, and county board chairman got together on the phone and discussed the issues. Chapin specifically wanted to know how we all felt about it. And, you know, nothing's come forward yet, but they were gonna go in and talk to the governor and or his high ranking aides to see what's possible. We did find out that some of the counties had already decided to open up on the 4th. I think that's premature for us to make any decisions. I think it was Derek that said we need a plan. And the health department, I've talked to the health department several times in the last couple of days, including this morning and last night, to let them know what those meetings were about, because obviously we're gonna be leaning heavily on them as how we approach it in a cautious and intelligent way to handle our offices and our elected officials and making sure that everybody's protected, including the public. So, yes, and I'll keep you all posted. One of the things I was gonna describe was the emergency declaration we have not done yet. We may have to have another special meeting depending on what the governor says to initiate that for the reason of being able to set up criteria in our own community, as the senators pointed out. And number two is to make ourselves available for these grant monies. We have to have an emergency declaration. We at present time haven't, because number one, we don't have any cases. IEMA has suggested, which is our state ESDA, has said that there's no reason to at that point, but I think we're fast approaching that point. So, depending on what the governor says in the next few news conferences through the end of the week will have a direct bearing on how we act, okay?
I mean, it's kind of the lens of how we view what constitutes an emergency, because certainly from a financial perspective, we are as, encumbered as any other county, right?
Absolutely, that's what it's all about. And, with the school, everything from school closings to shelter at home to, the list just goes, the nursing homes, our elderly, our people with pre-existing conditions, yes.
How has the state handled school closings? I mean, normally it's days, you get paid per days that you're in session.
They have
Continue to pay?
Yeah, they have continued or said they're going to. I don't think
Okay.
anybody's seen that.
Okay.
The governor has ruled out school for the rest of the year. I think you probably saw that.
You said something.
Actually, you're still teaching kids, it's just to do it at home, so you're still going on.
Sorry.
basic. You're not in the
And
classroom.
teachers are supposed to be working.
That's what I always do. I try to study from home a lot.
Yeah,
No,
Make sure I don't have a computer.
I'm sorry.
Yeah,
what-
and we didn't have a computer then.
no,
You said April 4th. Some counties had said some,
No, May 4th.
oh, May 4th.
May 4th.
Yeah, no, but you did some of
And
them.
I'm not sure I don't know how, I don't know how much thought's gone into that. Some of the guys we don't wanna do anything different, we wanna listen to the governor, county board, counties. And some were, the hell with it, we're gonna open the,
Can
it's.
they do that?
Well, that's my point.
Okay.
I don't think they can, and, and we can't
ready.
vote here and tell Augie to open up his office, okay? Or Don, or any, we've all gotta work on this together on a plan that makes sense, okay? In other words, instead of opening all your offices up on May 4th, maybe you ask everybody to come back and not, leave the offices locked and start handling phone calls and getting more and more work done. And then by a week-to-week basis, I'm just saying this hypothetically, then in 2 weeks, maybe if we still don't have any cases and it hasn't blown up anywhere, then you stand to open the courthouse up. And you work with the judges on what kind of cases they're gonna have. Because we don't wanna see on Fridays, twice a month, where we got 75 to 100 felons in here? I don't wanna see that. We still should adhere to social distancing and all the other things that make sense, I'm rattling on, I'm sorry,
Yeah,
guys.
well,
I've thought a lot about this, so.
I assume everyone's on the same page, that obviously you guys have the wherewithal to do whatever makes sense for your office. However, if we have a united front throughout the county, that's better overall as far as how it appears and how people perceive it and take it, right? So,
Well, I assume we've gotten along, and I'm not pointing that there would be a problem, but I'm just saying that we all need to work together is what I'm saying. And we need to listen to the health department and ESDA. Okay? And that's why before I went to this meeting, I talked to both of them. And then after the meeting, and this, because they've done a good job. I called the nursing homes to tell the administrators, because they're under attack, not just ours, but to tell them what a good job and how much the community appreciates the type of efforts they have made. These are the, we all gotta pull together.
you're still quarantined, Twin Lakes have a.
Well, and that's something that I
They
think
can't
needs
get
to
it
be
worked on. Yeah.
continued,
Right.
my opinion.
I think they should open barber shops. That's on one-on-one.
Yeah, maybe this thing back here wouldn't be sticking out.
Yeah, he said,
wait for that straight razor hot shave.
he needs a haircut.
So have we,
I've got one.
He's got one.
Someone other than you.
anyway, that's what I had on that. Questions, any input, I mean, it's gonna have to be all of our inputs in here to make this work. There's one other thing we need to do, and we found out we don't have to worry about till the next meeting. We'll get something out to you on elected officials' resolution on pay. We've got several elected officials that we need to take care of at the next meeting. I'm not sure we need to do anything with ours, but we need to address Angie and the coroner and
State attorney set by the state.
right, but we need to, okay.
And then the board members that just got
Right.
elected.
So we need to make sure we attend to that, because it has to be 180 days before they take office. So they take office on the 1st, 2nd, or 3rd of December. So we've got a little time, but we don't want to forget about that. Anything else to come before the meeting? Oh, I'm sorry, yes, Augie.
Yeah, not to beat a dead horse.
Please.
But just to reassure you that the functions of the county clerk and recorder's office are continuing on. It's a different way of doing business for us, but everything's getting done, and I have not heard the first complaint.
I haven't got any calls.
I really haven't. The way my people are rotating and coming in, it just seems, it's working. It's working. And, I don't think we've missed a beat, so.
Do you think the volume's about the same as what you were experiencing before? Is it
I
dropped a
do.
bit?
I do. I'll tell you what amazes me is the number of marriage licenses that are applied for.
That may have a counterpart.
Yeah.
divorce.
Yeah, give it a
Divorce
few
is
months
good.
and divorces are.
That's over there, that's over in Angie's office. I get you married, she gets you divorced.
Off the record, I hope that they're prepared here in about 9 months out there to deal with all the births.
Yeah, a lot of babies born around.
I did say it off the record.
But it,
Isn't that what you used to do, bring the, oh, never mind.
the other thing that I
Locked in
have.
a cage for a couple weeks.
I just got an update this morning from the census, 2020 census. Edgar County is at 53% reported, and I have a breakdown by municipalities. And obviously, some are a little bit higher than 50%, some are a little bit lower, so our average is right at 53%. And Gary, I emailed that to you
Yes,
this
thank
morning,
you.
just FYI. I mean, we're halfway there, I guess, is what that tells us. So,
Just an interesting aside on the census, because we went through this. The form specifically says you don't list kids away at college. And it came out right over spring break, right at the same time that kids weren't going back to college. So the US Census Department's gonna have a hell of a time figuring out some of that.
Better them than us.
Yeah.
Quite frankly, we'd rather have the kids here
Right.
than somewhere else.
You know, I've got a lovelorn 20-year-old moping around my house. I'll send up to your place if you really want to have college kids around.
I don't want to. I've had my share.
I never thought I'd hear the day Alex says, you know, I think I want to come home this weekend. And my wife goes, nope, you're not coming home. Then she got into tearing me down and go, your father has pre-existing conditions and he's old. Thanks.
Well, the only good thing about this, my wife only goes to Walmart about once every 3 weeks now, instead of every day. That's just good, you
My
know.
wife can't back away from the keyboard, it just keeps coming down the lane, and I said, listen, I haven't got a job, you gotta quit.
Is there anything else coming for the meeting? I'd entertain a motion to adjourn. Derek moves. Who's that? Andy? Andy seconds. All those in favor signify by saying aye. Aye. Opposed, nay. We are adjourned, gentlemen. Thank you for your time.